Good afternoon. I'm Dr. Vinayak. I'm a consultant in maternal fetal medicine in New Ramakrishna Shivashal. So basically today I'll be talking about indications of invasive testing, specifically chorionic villus sampling, and amniocentesis. So chorionic villus sampling is nothing but the sampling of placental bits from the uterus done at 11 to 13 weeks of gestation to know if the baby has any genetic issue or not. So, how do we know that a baby will have a genetic issue or not? So nowadays, if the baby is okay or not, we see in two different ways. First, if the baby has any probability of genetic issues, we do screening test at third month and fourth month. The third month test is known as combined first trimester screening. It consists of two tests: an ultrasound based fetal scan, nuchal translucency scan is also known as, and we add to that two serum markers or two hormones in the mummy's blood, and from that we put in a computer software and we put out a probability whether the baby is going to have the chances of genetic issue is low or high. Similarly, in the fourth month we do a genetic test known as quadruple marker. It's known as quadruple marker because we test for 4 hormones, and it also gives out a result which is based on probability, low risk or high risk. So when these reports have come as high risk, or if your previous baby has any genetic issues like Down syndrome, like cystic fibrosis, or there is any familial history of genetic issues, or if the mother or father have thalassemia, either beta thalassemia or thalassemia E, then it's necessary to test this baby for any genetic issues. So to do the genetic test, as I said, there are two methods. Either in the first 3 months we can take out the bits of placenta known as chorionic villus sampling, or after 4 months we do a amniocentesis, or we take out the amniotic fluid from the uterine cavity and send it for testing. Now both these tests are very safe. Yes, both these tests has a miscarriage rates of 0.5 to 1%. But in reality, in good centers, the miscarriage rates are considered less than 0.5%. So how do we do the test? First of all, we take the patient, we let her sleep, let her lie down, and we do an anomaly scan, ultrasound, to see the position of the baby, to assess which is the best way to enter the uterine cavity. After that, we prepare the patient under strict aseptic conditions. We clean the tummy and we put in a cut sheet, sterile sheet. We don our gowns, surgical gowns, sterile surgical gowns, and we start the procedure. During the whole of the procedure, the baby is strictly monitored under ultrasound guidance, and when we put in the needle to take out the fluid or the placental bits, we do it under the guidance of the ultrasound. During the procedure, you might feel a slight pain, a pinprick pain because of the small needle. Other than that, there is no need for any local anesthesia or general anesthesia for pain. Once the procedure is done, we ask you to rest for 48 hours. We give you a little painkillers and antibiotics, and you can start your normal activity after 48 hours. The risk of miscarriage is only up to the first 72 hours. After the 72 hours, there is no chance of miscarriage.